Hi, this is Dr. Kim. I'm an integrative and functional medicine physician, and I'm an LDN expert. And today I want to talk about something very interesting. I got a inquiry about pain. Is it possible that if you're on LDN, if you're about 4,000 feet, does it make your pain worse? So I want to answer that in an interesting way because about I've had chronic pain myself, and I've had intractable chronic pain, which means that it feels like you're going to die of pain. So I became very quite interested in helping others with that kind of pain, and I've been very successful, including my own pain. So let me share with you a story about a patient that was basically when this person had pain crisis. Pain crisis means that literally you feel like you're gonna die of pain. So when this person had pain crisis, one of the things that helped this person was the use of oxygen. So some people would think, does it make sense to use oxygen when you have pain? And I would say highly individualized. But some patients, I've used it in other settings where people have having pain crisis. I would have oxygen wide open, and if I had access to hyperbaric chamber, I would have used it. The reason for this, I don't really understand, but hypoxia, or where the tissues have relative lack of oxygen, appears to have uh, the pain triggered. So this person is in a facility about 4,000 feet, and the person says that the pain is worse. And I would say this is very consistent, nothing to do with LDN, but everything to do with chronic pain. The chronic pain at 4,000 feet is halfway to 8,000 feet, where most commercial airlines pressurize. 8,000 feet is also about the distance or altitude where people begin to have, some people, not all, altitude sickness. I think this person at 4,000 feet is having a minor or not so severe version of altitude illness that includes pain. So I think one of the things they can do would be oxygen, if they could use oxygen, and then let me know if that works. And then if they happen to have a hyperbaric oxygen chamber, that should make the pain better. Otherwise, another alternative, of course, is to go down the mountain, because that is the way to make that happen. So how do you avoid that? You go up a little bit at a time, maybe 1,000 feet one day, 1,000 feet one day, 1,000 feet one day, 1,000 feet one day. But it's not always practical because that person is in a facility for a reason. So I wish that person well, and I hope this video helps to at least explain the reason why they're having pain has nothing to do with LDN. As a matter of fact, if they stop taking LDN, my guess is that they're going to have more pain. So maybe double the dose of LDN, or maybe ask them to give you some oxygen, or ask them if they have access to hyperbaric chamber. Again, this is Dr. Kim on LDN therapy. If you like the video, please like, share, and subscribe. Thank you.